Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Have you ever wondered what causes a fracture in the neck of the femur, one of the most critical bones in our body? Well, let's delve into this topic. The femur is your thigh bone, and the neck of the femur is the slender, vulnerable part connecting the ball and shaft. When we talk about femur neck fractures, we're referring to a break in this specific area. There are primarily two types of these fractures. The first is a stable fracture, where the bones are aligned and barely out of place. The second is an unstable fracture, where bones have been displaced. We also have trochanteric fractures, another type of femur fracture that occurs lower down the hip. These fractures often occur due to falls or direct blows to the side of the hip, especially in older adults with weaker bones. Understanding the causes and types of femur neck fractures sets the stage for recognizing the signs and symptoms. So let's move forward and explore those next. So what are the signs and symptoms of a fracture in the neck of the femur? This is a crucial question to ask because recognizing these indicators is key to early diagnosis and treatment. One of the most common symptoms is severe hip or groin pain, especially when attempting to move or rotate the hip. This pain can be so intense that it may prevent the person from putting weight on the leg, leading to difficulty in walking or even standing. In some cases, the injured leg may appear shorter than the other or be turned outward, which is a telltale sign of a femur neck fracture. However, it's important to note that symptoms can vary depending on the type and severity of the fracture. For instance, stable fractures may cause less pain and allow some movement, while unstable fractures often lead to severe pain and inability to move the leg. Recognizing these symptoms is the first step toward diagnosis and treatment. If you suspect a femur neck fracture, how do healthcare professionals go about diagnosing it? Well, the first step is a thorough physical examination to check for pain, swelling, and signs of trauma. The patient's ability to move or bear weight on the affected leg is also assessed. Next, X-rays are taken. These provide a clear image of the bones and can often confirm if a fracture has occurred. However, in some cases, the fracture may not be visible on an X-ray. That's when a CT scan or MRI comes into play. These advanced imaging tests offer a more detailed view of the bones and surrounding tissues, making it easier to identify more subtle or complex fractures. During this diagnostic process, the type of fracture is also determined. Is it stable, with the broken ends of the bone lined up and barely out of place? Or is it unstable, with the broken bones displaced? Once a diagnosis is made, the focus shifts to the best treatment options. How do healthcare professionals treat a fracture in the neck of the femur? Well, treatment often involves surgery, but the type of surgical procedure varies. The choice of treatment often hinges on several factors, including the patient's age, overall health, and the type of fracture. One common approach is to fix the fracture with screws. This method is usually employed for stable fractures where the bone pieces still line up correctly. Another option is to replace part of the femur, also known as a partial hip replacement. This is typically chosen for older patients with unstable fractures where the bones have moved out of place. Sometimes the entire hip joint is replaced in a procedure known as a total hip replacement. This is usually reserved for patients with severe fractures or those with existing hip arthritis. So, there you have it. The treatment of femur neck fractures is a complex process that requires careful consideration of various factors. Successful treatment can lead to recovery, but there can be potential complications. What complications can arise from a femur neck fracture? As we delve into this topic, it's important to understand that femur neck fractures can lead to several complications. One of the most common complications is the formation of blood clots. These clots can potentially break off and travel to the lungs, causing a life-threatening condition known as a pulmonary embolism. Infections, too, are a serious concern. They can occur at the site of the surgery, posing a significant risk to the patient's recovery. Another complication to consider is hip joint arthritis. The trauma of the fracture and subsequent surgery can lead to this painful condition down the line. Moreover, some patients may experience differences in leg length post-surgery. This can cause mobility issues and requires further medical attention. Lastly, it's worth noting that a hip replacement might not function as well as the original hip, leading to limitations in mobility and lifestyle changes. Awareness of these complications is essential to manage and mitigate their impact effectively. UMCC, your ultimate medical consultants connectors.